Hey, in this video, I'm going to show you 4 exercises that you absolutely need to start now to loosen up and begin to heal your bone-on-bone hip arthritis. If these exercises even slightly loosen up your hip joints, then you've got an excellent chance at healing your bone-on-bone hip arthritis and possibly escaping having a hip replacement surgery. Now, if these exercises work for you, you're going to want to watch to the end of the video so that you can learn about the next steps to take after you've done these exercises. My name is Dr. David Medoff, and I'm a specialist physical therapist at Paso Manual Physical Therapy. And this channel is dedicated to helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. Please consider subscribing so that you don't miss out on any of the helpful tips we upload every single week. Let's get to it, guys. The first exercise is called Windshield Wipers for your hips. And it looks just like this. You're going to find a place to lie down on the floor or on the bed, wherever you like, with your knees bent like so, and just be comfortable. It doesn't matter how close your feet are to the rest of your body. Get a comfortable position. All you're going to do here next is open your knees and bring them together. And just an easy motion just like this, just out and in. You're going to do this for 5 minutes. Now, you don't have to go all the way out or all the way in, because if you have hip arthritis, if you got that bone-on-bone situation inside your hip joints, you may have lost some motion and it may feel uncomfortable to go all the way out here or all the way in. In is typically the more aggravating position. So just move where you feel comfortable. The point of this is to lubricate the hip joint by getting the fluid inside the hip joint to move around and circulate. And because you're not standing, you're not bearing weight, and this is a generally pretty easy exercise to do, it's ideal for getting that hip fluid to move and give nourishment, to provide nutrition to the layers of cartilage on the inside of the joint. So you want to do this for 5 minutes. Set a timer, go for 5 minutes. If you're doing the exercises along with me in this video, then just pause this right here and set a timer somewhere and go for 5 minutes while you figure out how far out and in you can go, and just move at a comfortable pace. You can slow down if you need to control it, or you can go a little faster if you want as well. This just should not hurt. It should feel comfortable to do, and it should feel like your hips warm up a bit. It shouldn't feel aggravating, painful, or achy in any way. It should feel good after you're done doing it. Okay, after you've done your 5 minutes worth of hip windshield wipers, next you're going to do butt squeezes. Now for this one, it's critically important to get the butt muscles active, to get them to wake up. And that's what you're focusing on in this exercise. You're trying to get your brain to connect to your butt muscles so that you can begin to use them on command for other exercises that you'll need to do as you progress through strengthening. Keep in mind, these exercises I'm showing you are just the first things you should do when you have a bone-on-bone hip situation. Once you're going to start to fix it, this would be a great starting point for most people. So in the same position, you're going to just squeeze your butt muscles and hold it for 10 to 20 seconds. Now what you need to feel is just these muscles back here in the butt tightening up. What you shouldn't feel is the front of the thighs working. If you do feel the front of the thighs working, then you've got to lighten up how hard you're contracting or change the position a bit. An alternative way to do this exercise is to put your legs down just like this so that you're flat, and tighten up your butt muscles from this position. For me personally, I feel this works the best for me, but this could be aggravating to some people for their if they have back problems, because the lying down with your legs flat like this could bother a back problem. So having the knees bent just like this, or putting a small pillow behind the knees and then lying flat with the knees slightly bent because of the pillow, that might work as well. So play with the positioning. The goal of this exercise is to get your butt muscles to tighten up. You're going to hold for 10 to 20 seconds and do this 5 to 10 times. So you're trying to get in about 100 seconds or more, ideally, of butt contractions without getting the front of the thighs or the inner thighs involved. You want to try to get the back of the hips back here, the butt muscles, to tighten up and work. So you can work from this position right here, tightening the butt. You're not really lifting up, you're just squeezing butt muscles. And if that doesn't work, find some in between your legs all the way flat and bent. I'm tightening up right here, butt muscles are working. And just tighten them up as hard as you can without other muscles working for 10 to 20 seconds, 5 to 10 times. And after you've done your butt squeezes, your glute muscle should be more woken up now. Now you're going to be ready to do a clamshell exercise. This is a modified clamshell. You're going to have to lie down on your side just like so, and ideally do both sides. I'll flip over here in a moment so you can see the other side. Once you get onto your side, you're going to lie down with your legs bent just like this. How far up your hips are and your knees are is up to you. The point of this exercise is that you feel the muscle burning or tightening up back here where your back pocket would be. If I were to put my hand in my back pocket, that's where the muscle is that I want to fire. It's the gluteus medius, actually the back half, the posterior half of the gluteus medius. You might get glute maximus as well. I want that muscle to fire because it's going to help to position the hip joint better, to optimize the motion, to get better range of motion and get the mechanics, the movement inside the hip joint to improve so that you can have less of a bone-on-bone hip joint situation and offload the cartilage inside your hip joint. So once you're bent like this, what you got to look at with your eyes is you want the top knee to stick out past the bottom knee by you rolling over just like so. You're not trying to slide your leg forward like that. You don't want to do that. You want to roll your hips and even your upper body over just like this so that this top leg sticks out forward past the bottom leg. Once you're in this position, now what you're going to do is pick up your knee, and it doesn't need to be very high. You're just going to hold it there for 10 seconds. If you come up higher, you might feel like your thigh muscles are working. We don't want that. Remember, we want the back pocket muscle right here working. The butt muscle, the side of the butt should be tightening up. So for me, if I roll over a bit more, right here, I feel my butt muscle tightening up the most. After 10 seconds, you can relax and repeat this 10 times on each side. So roll over, pick up the hip, and play with the position. Like I feel right here, I get the best contraction. That's what I'm after, is the best contraction, not the hardest feeling necessarily. I want it to be focused. I want my quad to not work or my hamstring to not work. I want it to be focused right back here because that's what's going to affect the hip joint the best. Right there, I feel it. See my quad fired and then it relaxed. I'm going to relax right here. I'm rolling forward, picking up just a bit. See, if I come up higher, it's not necessarily better. Now, if I roll forward a bit more and come up higher, I feel it. So you can do this modification. And then one of the tweak that you can make is if you point your toe up, see I'm keeping my heels touching, but I'm pointing my toe up on my top leg, that could light up that hip more. As long as you can tolerate it and you're not firing a bunch of thigh muscles, that's okay. Now this is not going to be productive for you if your whole thigh is working. Remember, you want to keep it to the glute right here. So roll forward and get that muscle to work right here. After you've done 10 reps, then you can roll over. I'll just do that for you. Or you can put your head over there. But just so that you can see the other side of this exercise. Knees bent, roll forward like that. I want this muscle right here to work. And I'm just picking up my knee so that this muscle works right here. After about 10 seconds, you can relax it. And I'm going to add my toes up to get this to burn. I have to roll forward a bit more in order to get this muscle to work. Now this is where this is modified, because a normal clamshell, you're not rolling forward so much, you're just straight up and down and you're coming up just like that. And it's probably going to fire more of the thigh muscles. We don't want that in this case. We want this muscle to work back here, the side of the butt muscle, in order to get the best effect for that hip joint pressure. You're trying to take off pressure from the hip joint when you do this. Now after you've done your clams, modified clams, next what you're going to do is a screwdriver exercise. Now if you've done all the exercises in order, you should have your glutes pretty warm so that you'll be ready for this screwdriver exercise. Now what you'll need for this is ideally if you have a rotating chair. Like I've got this stool right here and it rotates. A computer chair works pretty well too. It's okay if it has a backrest on it. And if you don't have a rotating chair, there's a modification that I can show you that I'm sure you'll have the equipment for. A chair and a pillow will work just fine. Now I'm gonna just raise this stool all the way. And all you're gonna do for that screwdriver is you're gonna kneel onto the rotating chair, and you can hold on to something for balance. I feel pretty comfortable right here, but if you feel like you need to hold on to a table, a counter, a piece of furniture, you know, like a couch or something, then do so that you're not gonna tip over. You're gonna put some weight through this leg, through your knee, and then what you're focusing on here is rotating in and out. And specifically when you rotate outwards with your legs, so the front of your thigh goes that direction, your foot goes that direction, you need to tighten the butt muscle. So let me just get in a better position here. All right, there we go. So you're tightening up right here. Tighten up. Tighten up when I go out. Squeeze. Squeeze the butt muscle. Squeeze. Another term I've heard for this exercise is a ratchet, kind of like a ratchet tool. Screwdriver. The idea is that you're twisting back and forth, and you have to squeeze the butt muscle. This won't be as effective if you don't squeeze the butt muscle, because you're turning on the muscle that shoves the ball in the right position in the socket to alleviate the pressures that are causing the bone-on-bone hip joint problem. That arthritis inside the hip joint wears down the cartilage inside the hip joint, and that's what sets up the bone-on-bone situation. Now, it's not the entire surface of cartilage that's gone. It's usually just a spot, and there's a lot of pressure inside the joint. If you can offload the pressure by getting the butt muscles to work, then there's a good chance that you can alleviate the pain and get back to normal activities. But you've got to begin to activate the glutes, you've got to depressurize the hip joint, and you've got to get lots of repetitive movement. That's why this exercise. Now, what I would do for this is time yourself. Go for 2 to 3 minutes. If you want to go even more than that, even better. As long as your glutes can tolerate it and you're okay being in this position, you know, as long as you're balanced, then you can go for it. But after 2 to 3 minutes, if you feel like you need to stop, then you can do so. If you want to do the other side, then you can do that as well. Now, a good frequency for this exercise would be to do them 5 times a day. In total, they'll take you anywhere from 10 to 20 minutes, depending on how fast you go. And if there's any of these exercises that bother your hip, then you should leave it out so that you don't aggravate your hip and potentially be in a situation where you can't do anything because it just hurts to move in any direction. You want to do exercises that make you feel good in your hip if you've got a bone-on-bone hip arthritis situation. Now let's talk about what to do next. If you've been doing these exercises for several days, maybe even several weeks, for some people they might even take months of doing this exercise, this exercise routine, so that you can get the hip joint flare down enough to tolerate the next level. If you're moving on to the next level, a good milestone or landmark to judge that you've surpassed these exercises would be if you can tolerate standing and walking for 20 minutes or more without flaring up your hip joint. If you can take 20 minutes worth of steps or being on your feet and your hip isn't biting you or isn't sore or achy or you're not paying for it the next day, then that's a great position to be in. That's a great sign that your cartilage has healed enough for you to tolerate weight bearing through it. The pressures in the hip joint have begun to normalize, and you're benefiting from these exercises. If you're in that position, then you need to move on to the next step. If you're looking for those exercises, subscribe to our channel. We've got tons of videos coming your way, and we've got some in the past as well. Go check out our playlists, and you'll find more strengthening exercises that you can do if you subscribe to our channel. I hope this video was helpful. Give us a thumbs up, and please subscribe so you don't miss out. Have a wonderful day. Bye-bye.